Well, nearly every one of us knows someone touched by breast cancer. It's the most common cancer for women in Arkansas, with more than 2,500 new cases expected this year alone. But with early detection, we can improve treatment outcomes and help save lives. We're here with Dr. Stacy Smith-Foley, a breast imaging specialist at the breast center at CARTI, to explain a little bit more. Dr. Smith-Foley, thank you for joining us today.
Thank you so much for having me.
So we want to start with, we always talk about early detection is key, but can you tell us why is it so critical to get that early detection, to get that early diagnosis?
Well, it's all about survival, right? So when we detect breast cancer at an earlier stage, the likelihood of living beyond that cancer diagnosis is extremely high. When patients are diagnosed at a later stage with more aggressive disease, their survival isn't as good.
And I know that we recommend especially women come in once a year to get their mammogram, but at what age should they start doing that?
Women in general should start at age 40 unless they have some family history. If you have some family history, you really need to talk to your doctor, and you might need to start earlier than age 40.
And when you're thinking about getting these yearly screenings, again, we already talked about early detection, but how easy is it to just make that call, get your screenings, and kind of be in the system for the next year?
Oh, it's very simple. You just pick up the phone, make the call. If you're coming to CARTI, we actually deal with getting your films from other facilities if you've been other places. If you haven't ever had a mammogram, now is a great time.
Yeah.
It's Breast Cancer Awareness Month. We're giving out goodie bags. There's a lot of fun energy about coming into a breast center this time of year.
Oh, yeah, a lot of camaraderie, I think.
Absolutely.
And I know CARTI is doing something special to make it even easier for women to go get their mammograms, and it's called Mammograms and Muffins, right?
Yes. Yeah. We are trying to reach out to people who are busy like me. I'm a busy working mom. I don't have time to take care of myself, but we're offering Saturday clinics at all 4 of our locations throughout the month of October. So if you're a busy working woman, don't hesitate to give us a call and schedule a screening on a Saturday.
And then finally, I know that, again, something unique that's happening this year, especially for Breast Cancer Awareness Month that CARTI is doing, is a new support group. Can you tell us about that?
Yes, we are so blessed. We've got 2 navigators, and one of our navigators, Lachey Johnson, has put together some slides to talk about general breast health and wellness. So this isn't necessarily targeted to someone who has had breast cancer, but for anyone who wants to make the best choices and be on top of their health. We welcome you to come this Friday at 1 o'clock in the lobby of the Breast Center at CARTI in Little Rock.
Perfect. Well, Dr. Smith-Foley, thank you so much for coming in and reminding us about all these great things that are going on. And of course, throughout the month of October, we're going to have a lot more coverage of Breast Cancer Awareness Month and all the great things that CARTI is doing. Thank you so much.
Thank you.